Hello, my name is Anna Nowak-Węgrzyn. I am a pediatric allergist immunologist, professor of pediatrics at the New York University Grossman School of Medicine. And I'm really excited to have this opportunity to discuss the important issue of clinical benefits of synbiotics that extend beyond the dietary management of infants with cow's milk allergy. Here are my disclosures. I do receive honorarium for this presentation, and I was a site principal investigator on a multi-center clinical trial, which was called PRESTO, which evaluated amino acid-based formula with symbiotics in cow's milk allergy. I have two objectives for today's talk. First is to describe the role of gut microbiota in food allergy, and the second to discuss the effects of hypoallergenic, extensively hydrolyzed and amino acid-based formulas with symbiotics on infections in infants and young children with cow's milk protein allergy, which is of very large practical clinical significance. So, immune system changes and develops throughout the lifespan, but we recognize that early life is a critical time for development of the immune system and as well as the gut microbiota. And we know that there is a sort of a mutual relationship between gut microbiota as well as the development of oral tolerance in the gut, as well as in general development and maturation of the immune system. And the disruptions in this early life processes may have potential later life consequences, which will express as infections and increased propensity to allergies in childhood, such as food allergy and asthma, and later in life to immune disorders. Such as autoimmune diseases or even metabolic diseases and obesity. The formulas that we have available right now are really of great quality, but they are not quite equivalent of human milk, because human milk is really the gold standard in infant nutrition. And the human milk, in addition to providing nutrients, it is also essential in protecting infants from infectious diseases. So we know there are many components in breast milk that reduce risk of infections such as gastrointestinal infections, otitis media, as well as wheezing and respiratory tract infections. And this benefit extends for years after termination. This is attributed to a multitude of immunostimulatory components of breast milk, so such as secretory IgA, peptides and cytokines that regulate gut permeability, as well as the presence of antimicrobial factors that are important for gut maturation, as well as development of the innate and acquired immune system, such as TGF beta or IL-10. There's also lactoferrin that is present in breast milk that is blocking inflammatory cytokines. There's a lot of lactose that acts as prebiotic. And finally, there are also human milk oligosaccharides that prevent microbes attachment to the mucosa and therefore provide protection against infections. There is ample evidence that infants with cow's milk allergy have different gut microbiota compared to healthy breastfed infants, and it can even be detected before they develop the symptoms of allergy. So the healthy breastfed infants has mostly gut bacteria that are enriched in Bifidobacterium species, Escherichia coli, Faecalibacterium prausnitzii, as well as a lactobacillus species. But when there is dysbiosis, such as in an infant with cow's milk allergy, there is a different composition and there's predominance of more adult-like and higher pathogenic potential bacteria such as Enterococcus faecalis, Methanobrevibacter, Clostridium difficile, and Campylobacter, among others. And another piece of information I think that is interesting comes from the studies of Kirsi Jarvin and Seppo from a cohort of Finnish infants that were exclusively breastfed. And it was observed that there's a different composition of breast milk, in particular regarding the composition of human milk oligosaccharides in infants who develop cow's milk allergy compared to the mothers of infants who are non-allergic, suggesting that alteration in the composition of the early infant feeding will predispose to development of cow's milk allergy. So human milk is the gold standard in infant nutrition, but it's also the ultimate symbiotic. It is not sterile. It does contain live bacteria, prebiotic oligosaccharides, as well as lactose, as mentioned before, that are very important for stimulation of microbiota as well as the immune system. Those are mutually important and connected. In fact, studies from animals, germ-free animals, demonstrated that those germ-free animals failed to develop oral tolerance. So we do we do need bacteria, probably more than they need us. And traditional hypoallergenic formulas that were used for the management of cosmetic allergy were, really fantastic in terms of not causing allergic reactions. So in terms of their hypoallergenicity and in terms of the nutrition, because they provided all of the nutrition that allowed those infants grow beautifully, but they did not contain those microbiota stimulating factors. So they didn't have any live bacteria. They didn't have any oligosaccharides with prebiotic effect, and extensively hydrolyzed formula contains small amount of lactose, but amino acid based formula contain no lactose. So, paradoxically, those infants who were already, at the outset of their allergy at the greater disadvantage and already had evidence of dysbiosis are being fed with the if breastfeeding is not possible, they are no longer benefiting from the those factors that stimulate the gut microbiota and immune system, and this is really a very important component of this of overcoming the allergies. So it is really exciting that this new generation of hypoallergenic formulas are striving to emulate the breast milk in terms of the immunomodulatory properties. So the formulas that I'll be discussing contain a symbiotic blend of pre and probiotics, basically to mimic the components of human milk and to target the gut microbiota dysbiosis. So the prebiotic in those formulas is a mix of either short chain galacto-oligosaccharides and long chain fructooligosaccharides, or short chain and long chain fructooligosaccharides with the predominance of short chain oligosaccharides. And this mix of prebiotics is similar to the levels and functionality of human milk oligosaccharides, and it is supported by ample evidence from over 30 clinical studies in infants, and it's supported by World Allergy Organization as a viable approach to allergy prevention. Bacteria that is a component of the symbiotic. So the probiotic bacteria is Bifidobacterium breve M16V. It is the most common bifidobacteria species in human milk and in the gut of healthy breastfed infants. So there's, good rationale for including this particular strain. It is selected for ability to reduce allergic responses, and this has been shown in many preclinical as well as clinical studies. And importantly, this particular strain has a very long history of safe use, even in premature infants, and it's free from the main food allergens, which is of course, a prerequisite for maintaining hypoallergenicity of the infant formulas. So these prebiotic and probiotics work synergistically to target the gut microbiota dysbiosis, hence synbiotic. Um, so here is a summary slide that provides an overview of clinical studies in allergy management with synbiotics. And initial studies were focusing on extensively hydrolyzed formulas, and they were comparing conventional formulas with the extensively hydrolyzed formulas with synbiotic. And those are studies that first evaluated growth, tolerance, and safety in healthy infants, then focused on atopic dermatitis infants, and the subsequent clinical trials were utilizing amino acid based formula with symbiotic, and the evaluated them first in the healthy infants for growth, as well as in infants with IgE, as well as a non-IgE mediated cow's milk allergy. So all of the spectrum, and you know that up to 40% of cow's milk allergy in infancy is of non-IgE mechanism. So it's very important. So I will review these studies in more detail to show you the interesting observations that have been derived from these studies. So when it comes to the studies with extensively hydrolyzed formula with synbiotics, so these studies showed that extensively hydrolyzed formulas with synbiotics was safe, well tolerated, and supported normal growth, which is like a absolutely necessary prerequisite. And it did had the effect of rebalancing the gut microbiota composition. So there were fewer infants with constipation and dry stools. So there are some gastrointestinal benefits, and these were exploratory and safety outcomes. Regarding the skin, in infants with atopic dermatitis, it was observed that infants with eczema and IG-mediated cow's milk allergy had improvement in skin symptoms. And also, there's a lower prevalence of asthma-like symptoms, so wheezy diseases, and use of bronchodilators at 1 year follow-up. So this was a very interesting sort of long-term effects of using the formula with synbiotics in the healthy infants as well as the infants with atopic dermatitis. Subsequent studies, as mentioned before, were done with amino acid formulas with synbiotics. And again, the new generation of formulas were hypoallergenic. So hypoallergenicity was confirmed. They were well tolerated. They supported normal growth, both in healthy infants as well as in infants with cow's milk allergy. And indeed, they rebalanced the gut microbiota composition. Again, the exploratory and safety outcomes showed that very interesting and clinically relevant effect of decreased frequency of infections. So fewer infections and fewer infants being treated with antibiotics, specifically fewer ear infections and use of anti-infectives such as amoxicillin, as well as fewer infections that were more severe and fewer hospitalizations. In terms of the gastrointestinal effects, there was improved stool consistency and color that was closer to that of healthy breastfed infants. And interestingly, there were fewer medication that were used for functional gastrointestinal disorders. And it was a very nice additional benefit. In terms of the skin, in infants with a non-IG mediated cow's milk allergy, it was observed that there was a lower use of topical corticosteroids for management of eczema. Uh, so, in terms of the effect of the formula with synbiotic on the gut microbiota, these three clinical trials showed a very consistent effect in sort of rebalancing the dysbiotic gut microbiota of infants with cow's milk allergy to make it closer in composition to the microbiota of healthy breastfed infants. So essentially, all three trials showed that there were increased levels of bifidobacteria in infants fed with the formula with synbiotic and reduced levels of pathogenic bacteria. In non-IG mediated cow's milk allergy, which the trial included young infants uh, who are being followed for up to 26 weeks, this effect persisted for up to 26 weeks, suggesting that similar to breast milk, there is a sort of long-term effect of this new formula with synbiotics. And similarly, in the infants with a severe IG-mediated cow's milk allergy, in the PRESO study, we have observed same trends with the increase in bifidobacteria and reduced pathogenic bacteria in stool. But this was, the composition of the gut microbiota. But really, as clinicians, we are interested in, tangible effects that are relevant for the patients. And as mentioned before, infections are really common in infants with cow's milk allergy, and in general, they're very common in the 3 years of life. So it was really exciting to see that those three randomized clinical trials that were done with amino acid formula with synbiotics did show reduction in infections as well as antibiotic usage. So you can see in the bar graphs that blue bars represent amino acid, conventional amino acid formula. The pink bars represent the amino acid formula with synbiotics. And in all three studies, you can see that there was a significant decrease in the infective episodes or use of antibiotics or specifically amoxicillin in the infants who were fed with formula with synbiotics. And we're talking again about the same product that contains a mix of short chain and long chain fructooligosaccharides and bifidobacterium breve M16V. In the study that I was involved, the PRESTO study, we have observed in the safety monitoring that there were significantly fewer infants fed with the formula symbiotic that require hospitalization due to gastrointestinal infections. So there's overall no difference in the infections in the entire study group. But in terms of the severe gastrointestinal infections, there was a significant signal. Uh, so just to close this, I want to show you the systematic review of all of the studies that were done with amino acid formulas with synbiotics. There's recently published, and it reviewed 4 publications, including 7 publications, including 4 randomized clinical trials. And you can see in the forest plot on the right that the analysis showed that in terms of the infections, there is a significant consistent effect in favor of the formula with symbiotic when it comes to the reducing frequency of infections. As well, there was a reduction in medication usage and hospital admissions, and it was both observed for IgE as well as a non-Ig mediated cow's milk allergy. And these studies were done, in infants and young children. So um, I think that, for clinicians, this is a very important piece of information that would support the use of those formulas when breastfeeding is not possible. Then we should be trying to use a formula that most closely recapitulates the immunomodulatory properties of breast milk. So, in summary, new generation of those hypoallergenic formulas, so extensively hydrolyzed and amino acid formulas that contain symbiotics, replicate the immunomodulatory effects of breast milk. So this is very exciting. This is really the next frontier in formula development. It has been shown consistently that these formulas with symbiotics promote colonization of the infant gut with beneficial bacterial communities. And they have a consistent, so both extensively hydrolyzed as well as amino acid formulas have a consistent protective effect from infections in early life. And this is very, very, very important. We know that infections and use of antibiotics by itself is a risk factor for development of asthma or food allergy. So reducing that risk is of very significant practical importance. And this is, especially relevant for atopic infants who are born with predisposition to develop frequent infections. And this is, explained by their immaturity of the Th1 responses, delayed maturation of the Th1 responses, and strong predominance of the Th2 responses, which are genetically pre-programmed. So I hope that this is a helpful overview of the beneficial effects of the hypoallergenic formulas with synbiotics, both extensively hydrolyzed and amino acid formulas, in terms of the additional benefits to the infants with cow's milk allergy beyond managing, dietary management. So thank you very much.